Good afternoon. Hello, welcome everyone. Thanks for joining us for today's COVID-19 vaccine update for residential aged care workers. So my name is Charles Broadfoot and I'm one of the professional development officers with the PHN. I'd firstly like to acknowledge the First Peoples and traditional custodians of all the lands in which we're meeting on this afternoon and pay my respects to elders past, present and emerging. So today's session is being recorded, and the recording and the PowerPoint slides will become available in our education library on our website within the next 24 hours. So you just head to our website, thepHN.com.au, and click on the education tab in the right-hand corner. So with GoToWebinar, you can type in questions for our presenters today. So you'll notice in your control panel, there's a questions box, so please type them in throughout the presentation. We have allocated some time after the main presentations to have a bit of a Q&A discussion with you. You'll also see an evaluation survey that will automatically pop up when the webinar ends. If you could just take a minute to fill that out before you log off, we'd be really grateful. We always really appreciate your feedback. So I'd now like to introduce today's facilitator, Kimberly Booth. So Kim is the Primary Care Improvement Team Leader and also the COVID-19 Response Lead with Hunter New England Central Coast PHN. So I'll hand over to you. Thanks, Kim.
Thanks, Charles. Hi, everybody. I too just want to acknowledge the traditional owners of the lands, various lands that we're all meeting on today, and pay my respect to elders past, present and emerging. So welcome everybody. It's lovely to know that we've got lots of people online today. There's lots of interest given where we are in the vaccine rollout, and there's, we've got 3 people that I believe are going to be able to answer all of your questions, or the majority of them anyway, because they're experts in their field. And I think the majority of us know who they are. So we've got, first up, before I introduce individually, I'll just say who our presenters are being. We've got Elizabeth Grist. So Liz, as we know her as, is the Executive Director for Clinical Services, Nursing Midwifery, and the COVID-19 Vaccination Coordinator for Hunter New England Local Health District. We've also got Patrick Cashman, and Patrick is our Immunisation Coordinator for Hunter New England Local Health District Population Health. And last but certainly not least, we have Hayley Ryan, who is a clinical nurse consultant and practice excellence lead with Uniting Aged Care. So what I would like to do first, because we know that Liz's time is quite limited, she's a very busy lady. So what I'm going to do is introduce Liz to you all and hand over to Liz so she can give you a little bit of an update about the current process to be able to access vaccination within the Hunter New England Local Health District.
Thank you. Can you hear me all right?
Can hear you perfectly.
Oh, great. Thank you. Look, it's great to be online, and I'm sorry I've only got 10 minutes or so, but I am out here at the Belmont Hub as we speak. We're doing a filming of the orientation. So I'm happy to join you, and I think the best thing for me to do is just give you a bit of an overview of what's happening here with our new hub, and then perhaps just ask if there are questions, because I think that that's going to be the best source of information for you. So as I said, we're out here at Belmont, and we are officially opening on Monday, the 19th. We have been inundated with bookings, requests, and so forth, and it's been, you know, really hard to see that people want to get vaccinated and so forth, but it's also very challenging trying to fit everyone in. And so I guess that's where I'm coming from with talking to yourselves and residential aged care facilities, because it's our biggest priority one of our biggest priorities to make sure that our staff in the residential aged care facilities in the district are vaccinated as well. So I think that one of the questions is, how do you get vaccinated? But I think it might be best if I just go to somebody to ask me one specifically, and then it'll probably lead on to all the information you need. So has anyone got anything that they'd like to ask me?
Liz, I'm not seeing anything coming through just yet via the questions. So maybe just touch on what you were going to discuss then, and if anything pops up, I can come back to you.
All right. Well, around April this year, I wrote to all 150 odd residential aged care facilities in our district, advising them that we were opening our hub at the John Hunter Hospital, and you know, we were happy to vaccinate residential aged care staff if they wanted to be vaccinated. We've had a massive uptake, to be honest. But there are new staff to residential aged care facilities, and some staff who hadn't quite decided. And we all know that there's now the ruling that to work in a residential aged care facility, you must be vaccinated by September. So I imagine that there are a lot of people out there that still want to be vaccinated. The best way for facilities to get their staff vaccinated is to let us know how many people essentially they would like vaccinated. And I know that I've had a lot of facilities contact me in the last few days that have got a number of staff, but they can't send them all in one go. So I need to know from you what suits you best and how many staff. We do have an email address, which I think that most people are aware of, because I know Ros Barker has sent that out, and that's the COVID HNE LHD COVID clinic booking change at healthnewsouthwales.gov.au, and I can send that to Marika again. And so there's that way, or you can just email me direct, and I'm elizabeth.grist@health.newsouthwales.gov.au, and we can go from there. Once we have your numbers, we'll make some contact with you and see what days and times you want your staff to come in, because even though you may not be able to book in, if you went on the tracker at the moment, you'd see it was full, the eligibility tracker. But we've kept some hidden spaces for residential aged care. So don't be worried, we will get you in, and we will work with you to get your staff vaccinated. There's also a call centre number which you may already be aware of, and that's the 1800 number, 1800 570 575. I just want to assure you that we'll do everything we can to assist you to make sure that your staff do get vaccinated by the due date. I hope that sort of allayed your concerns or fears about that, but I'm happy to take any questions.
Thanks, Liz. We've had a couple of questions coming through and it may be covered anyway during the further presentation, but we've got a question from someone located in Armidale. So facility in Armidale, just looking to the best location for staff, and again, probably just following the process that you just detailed then.
Yes, Armidale do have a hub, as you're probably well aware, and you can, if you want to email me, I will forward that on to them. But similarly, the operational director for Armidale is Susan Heyman. I think most people know Susan's email, but if anything comes to me, I'll direct it in the right spot.
That's great. Thank you. And another query coming from Central Coast location, travelling to the Belmont hub under current lockdown circumstances for the purposes of vaccination.
Yeah. Well, under the public health order currently, vaccination is a acceptable reason to leave a stay-at-home order. So yes, we are taking lots of bookings from the Central Coast. Of course, if someone's unwell, that they shouldn't travel. But yes, we are taking them even in the stay-at-home orders.
Excellent. Thank you very much. I think we've probably covered off everything you could probably give us today, Liz, given your busy schedule, and we really, really appreciate the short notice to join us and give that information. We know there's lots of people out there that have been looking for it, so thank you.
It's a pleasure. And look, Patrick's coming on soon, so he'll be able to give you more information. And also, if anybody, they've got Patty's email, and Patty will be able to give you mine. So be assured that we will work with you to make sure that anybody that wants to be vaccinated will be as a priority. Thanks very much.
Lovely, thank you. Thank you very much, Liz.
Bye.
Thank you. All right, everybody. I'm now going to introduce our next presenter, who is Hayley Ryan. So Hayley's as I mentioned earlier, clinical nurse consultant and practice excellence lead with Uniting Aged Care. Hayley's had 20 years experience as a registered nurse and has specialised in wound care over this time. Hayley has a raft of experience and qualifications, postgraduate clinical qualifications, and a number of clinical excellence and leadership awards to her name as well. So today, Hayley's going to present on behalf or under the banner of Uniting Aged Care, and I do have to make special note of how amazing Hayley's slideshow is, because it's quite possibly the best graphic I think I have seen so far for a COVID presentation. So welcome, Hayley. I'll hand over.
Thank you. Can you just confirm that you can see my screen?
Sure can see that lovely first slide.
Great. All right. Well, thank you to the PHN for the invitation to come and talk to you all today. And more importantly, thank you to you for coming along this afternoon when you're already flat out working. So I really do appreciate it. Before I jump into my topic, which is about COVID-19 and in particular the vaccination and the history of vaccinations, I just want to start by the purpose of our meeting today. It's really to provide you with some information, things that we know about the COVID vaccines that we have available to help you think through your decision when getting the vaccine. I'm not here today to talk about health orders or politics or any of that, because that can't be done by me. So I'm just here to talk about the vaccines and the history. But I do want to actually point out that we understand how difficult it's been for you. The messaging has been quite interchangeable. It has created confusion, and all we can do is really express our gratitude to each and every one of you for continuing to do what you do every day. So for that, we appreciate it. So hopefully you will get something out of my talk today. I am going to fly through the slides, and I'll probably skip over a few for the purpose of time, but I am going to make every single slide available to you so that you can go back and have a look and hopefully gain the information that you need. So let's get into it. Just a very brief disclaimer. Please, the views expressed here today are from the most available evidence to date. I still would encourage you to refer to your local policies and standards and those set by the government and peak bodies. Please refer to manufacturers' guidelines for any vaccinations. And the biggest point here, none of this information provided should replace your discussions with your own GP. So let's kick it off, everybody. Here's the topics that I'm going to cover. I'm going to go through what we know about coronavirus, so COVID-19, what we know to date, the history of vaccines, because I want to present a little story to you so that you get the understanding of all the information. Why we have vaccine hesitancy, some of the misconceptions, and I've picked those misconceptions based on what I have been asked when I've been actually providing the COVID vaccines, and we will end with a case study. So what do we know to date? Well, we know that COVID-19 was first noted in 2019 in Wuhan, China. It's in fact the third coronavirus in 2 decades. It was originally described in Asia after the severe acute respiratory syndrome, otherwise known as SARS. You would have heard of these, and the Middle East respiratory syndrome, MERS. The World Health Organization declared it a pandemic, and we knew that it spread by close contact via droplets, coughing, sneezing, singing, all of those things. And the majority of confirmed cases resulted in only mild symptoms. However, we quickly learnt that it can occur or can lead to the acute respiratory distress syndrome, otherwise known as ARDS, multi-organ failure, septic shock, and death. Now, the median time from symptom onset to the ICU for that older person, so I'm thinking of your residents here, is around 7 to 12 days. That's what the statistics tells us. And often they're placed on mechanical ventilation to help them breathe, and they're placed in a prone position. And what we do know is that any age can be affected. When I talk about prone positioning, so this is somebody in the ICU, and this is the position we quite often will lay you in. The purpose of this is to allow assistance to help you breathe. But it does provide issues because you're often in this position for over 12 hours a day, and that places your other anatomical areas at risk. So that being said, I want to delve into coronavirus so that you can see the story and the picture behind all this. So when we talk about coronaviruses, they're in fact large families of enveloped RNA viruses. They mostly infect birds and mammals, but in humans they can cause mild infection to the upper respiratory tract or more severe to the lower respiratory tract. These can manifest as bronchitis, pneumonia, or severe respiratory illnesses such as SARS, MERS, and COVID-19. So you can see where I'm going, coronaviruses. Let's delve a little bit closer. Let's have a look at MERS. This occurs as a result of the infection with the coronavirus MERS-CoV or CoV. On September 20, 2012, the Program for Monitoring Emerging Diseases reported a novel coronavirus isolated from sputum of a 60-year-old man in Saudi Arabia. Within the next month, the number of confirmed MERS cases rose to 9 with 5 fatalities. The earliest case dated back to April 2012. So you can see the progression. Across the globe, 27 countries have been impacted by MERS, but around 80% have actually occurred in Saudi Arabia. It's what we call a zoonotic virus, meaning that most cases often infection passes from animals to humans. And according to the World Health Organization, direct or indirect contact with camels is the most common route of the infection. And transmission among people is rare, and it mostly occurs among family members, so more close contacts and healthcare workers. MERS is an ongoing public health concern. There is no vaccine and no treatment, so it is being closely monitored. But when we have a look at SARS or SARS-CoV, what we know is that in November 2002, from bats, civets, and wet markets is where it started. It crossed again from animals to human, and from March 2003, the World Health Organization noted this as a global alert, and they raised concerns for travel and they started to screen at airports. By April that year, they ceased travel in Hong Kong, Toronto, China, and Taiwan. So this disease actually affected close to 8,500 people, and that actually caused 812 deaths. What we know is some of the key symptoms. Think about these symptoms: a dry cough, fever, diarrhea. So you're seeing some of the similarities here. The good thing is that there have been no cases of SARS for over a decade now. So hopefully we've got it under control. So that was MERS, this is SARS. Let's now take a look at COVID-19, SARS-CoV-2. What you can break it down to is if you actually have a look at COVID-19, CO stands for corona, VI, virus, D, the disease, and the year, 2019. Now, this virus has a close resemblance to SARS. Now, what you know is that, well, what we know is that this has affected the total cases around 185 million people. We're looking at over 4 million deaths, and have a look at the symptoms: a fever, a dry cough, shortness of breath, fatigue, headache, the list goes on. There is no treatment, but given how quickly it spreads, given the current concern, besides what governments are enforcing with social distancing, wearing masks, etc., we do have some vaccines on the market. And in Australia at the moment, we're looking at Pfizer and Oxford AstraZeneca. Now, important to note, COVID-19 can occur without any symptoms. It can also cause symptoms that are severe, and complications can be fatal. Doctors do not yet know the full impact to the body after you actually get rid of COVID. So according to the World Health Organization, this is what they tell us: 80% of those with COVID do recover. 20%, however, become seriously ill, and 5% do need intensive care. So the key message here is even if a person has no symptoms, they can pass the infection to others, and it is vital to take steps to prevent this. So factors that increase the risk of becoming severely ill by COVID: smoking, pregnancy, diabetes, obesity. You can see the list there. Those with a weakened immune system, such as blood or bone marrow transplants, immune deficiencies, HIV, those on corticosteroids, for example, they have a higher risk if they get COVID to becoming severely ill. There is a recovery time, and here are some of the figures that we know that often you will feel better after 2 weeks. Those that are hospitalised, however, it can take up to 42 days. But what we are starting to see emerge now is some long-term effects, such as people saying they've had the COVID virus, they've recovered, but now they often experience fatigue or difficulty breathing or chest pain and coughing as an ongoing issue. So you can see the list there. I thought I would bring to your attention this bar chart so that you can see the cases of COVID-19 by age and by sex. And what you can see down the bottom is the age. So it's here, it's written here. This is the evidence. People from 0 to 9 years are being affected, right up to 90 plus. Now, the proportion of COVID-19 cases in males and females is pretty much similar, but cases have been across all age groups. The majority of cases, however, and I just want to point this out to you, is have a look at this graph. The majority of people who are getting COVID are between the ages of 20 to 39. Why that age group? Well, more research needs to be done, but you know, some research is alluding to that these are usually your risk takers, those that are going out still, listening to social media, etc. And these are the groups that are actually getting sick. The problem with that is that they often recover. And if you have a look at the deaths that we're seeing, and it's no surprise to you working in the aged care industry, is that those that are actually dying from the disease, if they get it, are in that older age group. No surprises there. But just be mindful, there are others that are still dying at a younger age. And we have some people in the ICU at the moment in New South Wales. So just be mindful of spreading the disease as well. Now, I thought for the purpose of this talk, because I am talking to those in the aged care industry, it's important to pull up the cases within a residential aged care industry. And what you can see here is those that are active, recovered, and those that have passed away. A lot of them did contribute from Victoria when they had the outbreak. But what are we seeing now? We're starting to see New South Wales with a heightened risk at the moment. We hope that we do not reach this, but you know, nobody can predict that. So just stay vigilant in what you're doing. Okay, I wanted to take a very brief look at the history of vaccines, because a lot of skepticism comes across, well, why do we need vaccines? So I wanted to take you through some of the information. Firstly, this is a history of vaccines, a bit of a timeline, chronology of the main vaccines developed since 1796, when Edward Jenner, an English physician, developed the first vaccine against smallpox. The practice of immunisation goes back to an earlier time, back to the Eastern world, when they used to drink snake venom to confer immunity to snake bites, and smearing a skin tear, for example, with cowpox to gain immunity against smallpox in the 17th century. But since Jenner's critical discovery and up until the late 1950s, all the vaccines implemented throughout this time span were developed at a very slow rate. It was the new scientific discoveries and technologies of the last several decades that led to more rapid advances. And you can see that by the centuries on the screen. So let's go back in time. Let's go back to 1918. The Spanish flu was declared a world pandemic and one of the deadliest in history. In fact, it infected 500 million people. That was 1/3 of the planet's population. It killed 50 million people, and you either died from the disease or grew immunity with a focus on wearing masks and quarantining and good hygiene. You know, we're all complaining about the masks we have to wear now, but could you imagine these little pokey masks that we'd have to put on? I'm kind of glad we've got the ones that we have. So this pushed for a focus on developing vaccines, this Spanish flu, and the first influenza vaccine was created in 1938. Let's take a deeper dive. what you can see on the screen here is the preventable diseases. So it's shown in the reduction of cases since the vaccine was actually put forward. So one example for the top one, diphtheria. Pre-vaccine, 158 cases per million per year. Then we introduced the vaccine and we dropped that down to 13.7 deaths per million per year. So it's a good little understanding of the importance of vaccines. And to put it a different way, I really like this this little graphic here, which, you know, the child says to his mum, "What's that mark on your arm, mama?" "It's my smallpox vaccine scar." "Why don't I have one?" "Because it worked." Now I know that my mother has one of these scars and I don't. So, you know, vaccines have come a long way. And just a little personal touch, I actually ran a COVID vaccine clinic a couple of weeks ago for a disability services, and I vaccinated over a few days around 150 odd people.
Kim popping in now. I really hate to interrupt. I just noticed a little bit of a glitch with the audio, so we might just turn your camera off.
Thank you for that.
Thanks.
Thank you very much. I will turn the camera off. Does that come across a bit better?
Yes, thanks, Hayley. Loud and clear.
Thank you. You don't need to see me anyway, so you've got the screen. Look, I was just describing that a few weeks ago, I ran a COVID clinic giving COVID vaccines to 150 odd people living with a disability. And they were coming in with their elderly parents, and they started telling me the stories of how they became disabled. And I've seen very quickly a bit of a trend. A lot of those actually got their disability from rubella. And the parents, the elderly parents, said they weren't vaccinated. So that was a very huge insight into how vaccines can actually prevent you from becoming ill. So based on that history, based on that information, I now want to just talk about vaccine hesitancy. Why is this the case? Well, many people are just trying to do the right thing, right? You know, nobody wants to get through life with hurting anybody else. But the problem is there's so many sources out there that are providing misinformation. And it's no wonder we're all so confused. I actually say to my colleagues, I wonder if it was doctors and nurses getting up every day instead of our politicians telling Australia about what to do, if that would make a difference. You have to wonder. You know, I think Gladys and the team and the politicians are doing a great job, but we know that the community have more trust in doctors and nurses. So let's talk about vaccine hesitancy. Firstly, hesitancy and the anti-vaccine movement can really be traced back 200 years, back to 1840, when the British Vaccination Act mandated smallpox vaccine. And actually the phrase conscientious objector came from people who had religious concerns and objected to receiving the vaccine. And then we fast forward to 1998, when Dr. Andrew Wakefield in the UK falsely linked vaccines to autism, which has been proven and tested over and over again to show that that was false. Also, polio, that could have been eradicated similarly from religious leaders in the Middle East, misinformed people of the polio vaccine, stating it was laced with estrogen and could cause a man to become sterile. And in fact, Elvis Presley even stepped up at that time and said, "Take your polio vaccine." So false information has been around a long time, but because of social media, it's now more influential. It's more available. And with any new and emerging disease, there is always fear. There's always stigma associated with it. And you have constant changing information bombarding us. It doesn't mean the information has been wrong. It's just that we are now seeing the information coming through in real time, and we're not used to it. It is important to respect everybody's views, and I really, really want to point that out. I've stopped asking, why are you not getting the vaccine? And I start asking now, what have you heard in the community? It's a total different questioning. Now, when we talk about vaccine hesitancy, the experts have placed people into three groups of people. You've got pro-vaccinators. They just want to get it done. They've already lined up. They want their vaccine. There's the vaccine hesitant. They're a little bit unsure given the media information and they just want more details. And then there's those with really strong views. They're often a small group, but they're very influential. They're often non-science based, and quite often they'll bring along some conspiracy theories. How many times have you sat in the staff room and you hear somebody say, "I heard that," blah, blah, blah. So when you hear that, you know that it's not evidence-based a lot of the times. Where we want to focus our work on, or focus our efforts on, is those that are vaccine hesitant, because we have an opportunity to give them real information and science-based. I think it's an optimal time as well to focus a little bit along the side of religion. And this has come up quite a lot. I get a lot of questions about, I can't have the vaccine due to religious beliefs. First and foremost, I respect anybody's decision, but I do give facts, and I want to give you some statements that is available, and I also have them in my reference list. Firstly, those of a Catholic faith. They put out a clear statement, and it was actually approved by Pope Francis himself. It is morally acceptable to receive COVID-19 vaccines that have used cell lines from aborted fetuses, and I'll get to that shortly, in their research and production process. They have endorsed it. If we look at the Muslim faith, they have also endorsed the vaccine as well. In fact, there is a religious obligation to preserve human life that has been honoured by Allah the Almighty. And they go on to say that they understand that the vaccines do not have any animal products. We know that for this faith, pork is a concern. And I understand where they're coming from, because sometimes the vaccines are made with gelatin. Gelatin can have animal byproducts, etc. In this case, there is no problem with the current vaccines. A quote from a pastor of a Pentecostal church said, "Whilst we must protect the Holy Spirit, taking the vaccine should be the sensible approach to safeguarding our community." And this pastor went on to say, doesn't it make more sense to take 1 or 2 vaccines than end in a hospital where you're actually getting pumped with a lot more medications? And then to your left, I have actually listed the following denominations that have no theological objection to vaccination. So that should hopefully guide you in what we know is available. Now let's get into the misconceptions. Now I am going to go through this rather quickly for the purpose of time, but you will be able to revert back to my slides. The biggest one that I hear, can you get COVID-19 from the vaccine? Simple answer is no, you can't, because you're not getting a live virus. The vaccine basically tells your body how to make small parts of the virus so that if the virus comes into your body, it can attack it straight away by remembering it. So no, you cannot. The vaccine must not work if I still need to wear a mask and social distance after. The vaccines are safe and effective at preventing disease in the vaccinated person. But whilst the vaccine will prevent illness, it is still unknown if you can carry it and spread it. Hence why we still have you wear the mask. What about long-term effects from the vaccine? Okay, we're not 100% sure where this is at the moment. That's the truth. But most side effects from the vaccine occurs within the first 30 days. And because of that, the TGA went a step further and tested it over 3 months instead of just 30 days. And those side effects I actually provided to you earlier, with some coughing, chest pain, etc., it is a common side effect. I'm healthy. I never get sick, so I don't need to take it. You can still contract the infection and you can still spread it to others. This one was presented to me last week. After 40 years of research, there is no vaccine for HIV. There is no vaccine for cancer, and even the common cold doesn't have a vaccine. Let's break this down. HIV. We've developed vaccines for HIV and spent millions of dollars. But this is a smart virus that keeps mutating and therefore shielding itself from the antibodies. Now, just because there is a vaccine does not mean, that we don't have a vaccine, it doesn't mean that we actually haven't cured people from HIV, because we have. Now, the common cold, there's actually over 200 viruses for the common cold, and people don't die from it. So why would we want to create 200 more vaccines every year for somebody? Cancer, well, we don't have a vaccine for cancer because it's not a virus. But what we do have is HPV vaccines that prevent cancer. You can see where I'm going here. Another misconception, the COVID-19 vaccine includes a tracking device. Boy, oh boy, every time I turn the social media on, I'm seeing somebody else tell me that they're being tracked. So I thought, rather than simply telling you there's no tracking device, which there's not, I thought, let me give you the history of how this rumor started. This came about from a video that was shared on Facebook, where a syringe maker in America, they actually had a contract with the government to provide a medical grade injection device for vaccines. The company had an optional version of its product that contained a microchip within the syringe label. And what that did was confirm the vaccine's dose. So it was purely a checking system. But the chip itself is not injected into the person. To date, there is no tracking devices, no GPS in any vaccine. The vaccines are not safe for those who are pregnant, breastfeeding, or planning pregnancy. Okay, a huge study was actually done on this. Firstly, Pfizer is the preferred vaccine in Australia for this group of people, and that's simply because AstraZeneca doesn't have any research on pregnant women at this stage. There is real-world evidence that has shown that these vaccines are safe. If you recall my previous slides, a high risk group of getting COVID is somebody who is actually pregnant. So it is far more important that you actually do get vaccinated. And they did a huge trial of over 35,000 pregnant women who were given the vaccine and showed that it was safe to do so. Also breastfeeding and planning to get pregnant, both for males and females. I get asked by males as well who are trying to conceive, as trying to get their wives pregnant, the same question. The vaccines have a fetus in them. Okay, the vaccines do not have a fetus in them, but let's talk about the history as to why people believe that they do. Firstly, Pfizer and Moderna did perform confirmation tests to ensure the vaccines worked using fetal cell lines. AstraZeneca used kidney cell lines from a fetus aborted in 1973. Fetal cell lines are not the same as fetal tissue. They are cells that grow in a lab. Now, they descended from cells taken from elective abortions in the late 70s and 80s. Very important to note that none of these vaccines use fetal cells during the development or production phase. So no fetal cell lines were used to make the vaccine, and therefore they are not inside the vaccine. And I know that comes up a lot. I get asked that question regularly. The COVID-19 vaccines, and this is probably the biggest one, are unsafe because they were developed so quickly. Well, that's not the case. They were actually developed around the same time, but we had more resources. The world has actually thrown in huge amounts of money, huge amounts of extra resources to get the job done. Think about it. If I gave you 10 more staff tomorrow in your residential aged care home, how much more work would you achieve? It's the same thing. Also, we already had the technology developed. Why? Because we've already started the work with MERS and SARS, and that's why I took you through that journey. We also know that China isolated and shared the information quickly so we could start working on it. No steps were skipped in the testing of the vaccine, and utilisation of the mRNA allowed a faster approach. And in fact, this is where social media helped us, because we actually were able to find a lot of volunteers so the scientists could start looking at people in putting them into the trials. So no steps were missed. They still went through the same rigorous testing as any other vaccine, and they are proven safe and effective. Now, I'm not going to go through the next couple of slides for time, but just very briefly, when the trial was undertaken, you get two groups. A control group, they're given a placebo. In this case, they were given an injection of normal saline, and you get a trial group. Those people, they get the injection. And then what you do, you compare the two and you look at the side effects and the symptoms. And what they found, very interestingly, even those that were just given the normal saline, they actually, as the placebo, they actually said that they had a sore arm as well, or they had some symptoms as well. So it shows that it's actually very safe. Okay, here's some of the problems, and here's some of the suggestions that I have. When it is getting too noisy out there, and it is quite frequently, switch off. Turn off the social media, Turn off the TV, readjust yourself and think, what are the facts? Because it can become overwhelming. You're getting thrown left, right and center. You're talking about it in the meal breaks and it becomes overwhelming to the point where you don't know what to do. Very interestingly, I will tell you that I pulled up Facebook's financial report, and I can tell you that because of the anti-vaxxers and all of their posts on Facebook, they actually made them $7.8 million to Facebook. That's how much revenue it generated because of the anti-vaxxers, which is why people like Facebook are not going to take those anti-vaxxers down, because they're getting money from it. So if you've ever looked on Facebook, for example, you get a little pop-up that says COVID is safe, COVID vaccines are safe. So you can see that it's a money grabbing. So think about what you're looking at and is it good advice? So firstly, is Dr. Google good advice? How many times have you actually put into a little search button, I have a headache, what do I have? And what comes up? You suddenly have a brain tumor. Let's get real. So think about reliable sources of information. Therapeutic Goods Administration, TGA, it's accessible to everybody. The Australian Department of Health, the World Health Organization, and if you want to do further training, CIPSI has some very good resources. Now, I have a few moments left, so what I'd like to do now is present a case study, one that is very close to me, and I'll explain that as we go through, but a very touching story that I believe is relevant to you all today. So this is the case study of Elizabeth McNeil, born in 1933, lived to 88 years old. Now, Mrs. McNeil had no comorbidities, no medications, and was pretty fit for her age, still lived at home. She was a loving mother to 4 children, 12 grandchildren, and 13 great-grandchildren. And I'm going to take you on a little history of Elizabeth. So Elizabeth did actually get COVID, and I'd like to take you on her journey. On the 19th of January 2021, her daughter has alerted the family that COVID-19 was in her workplace, and she was advised to isolate. By the next day, the daughter had returned a positive COVID test, and she said that she had a sore throat, chills, and a headache. And she mentioned to the family, luckily I had a mask on last weekend when I came to visit. And that mum only needs to be tested if she becomes symptomatic was the information provided. On the 21st of January, Elizabeth tested for COVID-19 by the nurses. She felt a bit tired, but no other symptoms. Family described their mum as full of life, always ready for a laugh, always active in the house and yard, always had the kettle on, and just loved people being around. And you can see that by the wonderful photo. And by the way, I do have permission to tell Elizabeth's story and show her photos. On the 22nd of January, Elizabeth informed her children that she got her test results back and she had COVID-19. By the evening, she was wheezing, short of breath, and had a cough. On the 23rd of January, Elizabeth was weak and unable to get out of bed. An ambulance was called and she was admitted to hospital. On the 24th of January, it happened to be Elizabeth's 88th birthday. The family celebrated as best they could via Zoom, but at the same time, the brother had also now tested positive for COVID. On the 25th of January, the niece visited Elizabeth and she was allowed to go straight into the room in the hospital and was quite surprised. But the nurse advised her, given her current prognosis, that I would suggest you get all of the family in. By lunchtime, her breathing was laboured, she was restless. By midnight, she commenced morphine. Elizabeth struggled throughout the night, in and out of consciousness, and unfortunately, by mid-afternoon on the 26th of January 2021, Elizabeth passed away. Her family report that she struggled to breathe and it was so hard to watch. It was a long, slow, and ugly death. The funeral was held, and because of the restrictions, only 19 family members and the postman, I was told, were able to actually attend the funeral. As you can see, I bring this to you today because you can see how quickly the turn of events can occur. And you can only imagine the family turmoil knowing that the daughter actually had the COVID virus in the first instance. I would like to thank my colleague, Georgine McNeil, one of the daughters of Elizabeth, for allowing me to tell her mum's story, particularly knowing how close this is to her heart and the strength that she has shown to give me permission to tell this story. But Georgine wanted me to give you the information so that you could make an informed decision. So with that, my last slide for you today. Should you get the vaccine? Well, getting the vaccine is better and safer than getting COVID-19. You can help protect yourself from severe disease, and you may also be protecting others at the same time. It is a good idea for most people to get the vaccine, but ultimately, you will need to make the decision that is right for you. Continue to follow the protocols, and thank you for listening to my talk and taking the time to do so. Thanks very much.
Thank you, Hayley. That was fabulous. I know we weren't able to see your face towards the end, but it was an incredibly informative and I believe reassuring type information session. Very grateful. I've learnt quite a bit myself today, and it's going to assist with some of the conversations that I'm frequently having. So thanks for your time, Hayley. And I know we've had a number of people put in questions just saying that they'd like the link to the presentation at the end. So that'll absolutely be happening, and all gets stored, the recording gets stored on our website in our education library, usually the very next day after the presentation. So without further ado, I'm now going to introduce our next presenter, Patrick Cashman, who is the Immunisation Coordinator for Hunter New England Local Health District and resident friend, because he has done a lot of these for us, and a lot of you will know Patrick as, yeah, he's been in the space for a long time and has an incredibly large amount of information and knowledge related to all things vaccine and vaccine safety. Patrick initiated and also does manage the VaxTracker active surveillance system for adverse events following immunisation, and is part of the AusVax Safety Consortium. So I'm going to hand over to Patrick now, and I'll be back at the end to talk about question time.
Thanks, Kimberly. That's great. Can you see my slides?
I can.
Great, fantastic. So I'll talk about vaccine hesitancy. Thank you very much to Hayley for presentation. That was really good. There's lots of different ways to encourage people to get a vaccine, any vaccine. And the most important is the top there, access. Now, as all of you've worked in residential aged care, you've had teams come around and immunise the residents there. We've missed the boat in terms of not immunising staff. I think that would have been lovely for the government to show care for the staff and immunise them at the same time. But that ship has sailed. But now we're asking you guys to step up and to make sure that you don't make the same mistake as the government and forget to vaccinate yourselves. So really, really important. Now, a lot of people in the community aren't able to get the vaccine yet because they're not in a priority group, but you guys are all in a priority group. So you've got access to the vaccine, but you've got to do it yourself in your own time. It is free, but it's not just going to turn up at your doorstep. And some of these other things we'll address and Hayley's already addressed. So how do vaccines work in general? Well, in general, the bacteria or the virus on the left, we get a little bit of it and introduce that to the immune system, and then the antibodies recognize that, and it's a sort of a lock and key mechanism, so that the lock is the antibody and the key is the antigen from the bacteria or the virus, and then you can remember that. And when you meet that again in the next time, you only need to cut the key once, and then you can open that door every time, and that's what the antibody does. Now, this is the coronavirus and the famous spike proteins on the outside, and it's called corona because it's like a crown, and the spike proteins under the microscope give it a crown appearance. So with the AstraZeneca vaccine, there's a little bit of the DNA that's taken from the coronavirus, and then that's put inside an adenovirus. So this thing up here is an adenovirus, and an adenovirus is a common cold virus. And there were some questions about why the adenovirus for the AstraZeneca vaccine is a chimpanzee adenovirus. And the reason is because if it was a human adenovirus, so an adenovirus that affects humans regularly, your immune system would already be immune to it. So it wouldn't let that adenovirus carry that bit of DNA into your body. So the adenovirus, what it does is it protects the DNA. You can see the squirrely bit of red DNA on the inside of the virus there, protects that so then it can get inside your cell, and this blue one here, and then it pushes the DNA into the nucleus and it makes messenger RNA. Then on the right-hand side, the messenger RNA is like a story, and it tells the cell then to make the spike proteins that then display on the outside and stimulate those antibodies. Now, the mRNA vaccines, the Pfizer vaccines, don't have that adenovirus to protect them. And it's an RNA vaccine, it's not a DNA vaccine. So the little bit of RNA floats around freely, and it's in a little fatty capsule there, and then that gets into your cell and it tells the story. So it's not like the first one I showed with the lock and key. It's not like the key, which is how most vaccines work. You put the key in and then it makes lots and lots of keys so you can keep opening that lock all the time. It's actually telling the cell how to make it. So it's like having the locksmith in your cell. It's telling how to make those keys. And then this funny shaped thing over here is your immune cell, the dendrite cell, and that makes the antibodies when it's challenged. And that's the Pfizer vaccine and the Moderna vaccine. That's the vaccine we're using for people under 60 in Australia. So this is a different graphic of that same vaccine. And I just draw your attention to this middle one here, the pink one, because the messenger RNA, the little story about the RNA, is contained in a little fatty globule there that contains the little messenger RNA. So then when we look at the ingredients, so people have asked for this webinar, what are the ingredients in the vaccine? On the left-hand side is a list of everything that's in the Pfizer vaccine. If we have a look at it, the top dot there is the active ingredient. That's the messenger RNA. That's the little squiggly bit we saw on the diagram. And then the next four are lipids. Lipids are fat, so lipid, 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 lipid. And they're the casing around the messenger RNA to protect it. But it's still very, very fragile. We know those vaccines have got to be deep frozen at -70, then they can be kept in a fridge unopened for a month. And then when you're mixing it up, you can't shake it vigorously because that will destroy it. So the lipid casing's very fragile, but it protects it enough so we can transport it. And then you've got some salts and some sugar. So there's really nothing in that vaccine that's going to cause you any problem. It's a lot of these things you'll find. So potassium chloride, cholesterol, you know what cholesterol is, it's in your own body anyway. Sodium chloride's common table salt, sucrose is sugar. So these are things you have in your kitchen anyway. So these are nothing to be afraid of. And on the right-hand side, the AstraZeneca, a very, very similar story. Polysorbate 80 is a surfactant, so that stops the vaccine being absorbed into the glass of the vial. And polysorbate 80, it's contained in lots of things, cosmetics, and it's contained in lots and lots of foods, including soft ice cream. So you might not want to have soft ice cream every day. That might not be healthy for you, but in this sort of quantity, it's not a problem. So there's nothing nasty in these vaccines that's going to worry you. Now, vaccine safety is really, really important. So for the vaccines, have got to pass some trials, phase 1, phase 2, phase 3, phase 4. Then we do this phase 3, and then phase 4 is what happens out in the community. We've got to keep an eye on the vaccines to see what's happening, and that's the Vax Tracker system that I made. We've got over 1 million people in it now. We do these phase 4 studies where we're looking to see what's happened, because the phase 3 studies the company does may have some tens of thousands of people in it, but now we've got millions of people and we can find out new information. And vaccine safety is a little bit like being a lifesaver. So people say, well, why are the rules changing all the time? And it's a bit like on the beach. It's a dynamic situation. So if we set up the flags and we know people can swim there, people know, they come and see the flags, they go, oh, it's safe to swim here. That's fantastic. I've got my lifesaver hat for a prop. and people say, oh, you can swim here. That we know it's safe. But then if a rip opens up between the flags, the lifesavers are looking at the conditions and then they make changes. They're going to move the flags up the beach where there's no rip. And it's exactly the same with vaccine safety. So ATAGI are like the lifesavers. They're keeping an eye on all the data. And if they notice a problem, then they change the rules. So AstraZeneca was able to be given to anyone. and then we noticed the problem with the blood clots, and ATAGI said, well, let's not give that vaccine to anyone under 50. And then they noticed more problem with blood clots, and they said, let's not give it to anyone under 60. So that's why the rules change. And the rules changing is a good thing, because it means we're watching, we're keeping an eye, and keeping good surveillance and making things as safe as possible. So this is some of the data from AusVac Safety. We've given over a million surveys to find out what's happening. And these are common side effects. So a lot of people report common side effects. So nearly half the people. So if you do get the vaccine, it's going to knock you around a bit, but it's going to protect you, like Hayley nicely pointed out. So this is a really nice graphic from ATAGI about on the left-hand side is the different age groups in the orange column, and it's the risk of the blood clots with the AstraZeneca vaccine for every 100,000 people. And this is in a situation, like a medium situation, which is like the outbreak in Victoria not long ago. So you can see here for young people, there's a risk of blood clots. But then as we get older, the risk of blood clots falls away. So people over 60, the people between 50 and 59, the risk of blood clots is 2.7 per 100,000 people. But for 60, it falls away to under 1.5. Whereas if we look at the blue side's the risk of disease. What happens if I get COVID disease? Now, the little dot at the top are deaths, and the bright ones underneath are ICU admissions, and the dull ones underneath are illness. Now, you can see here that as we get older, the illness gets bigger. And on the left-hand side, as we get older, the risk of blood clots gets smaller. And then ATAGI has decided, by looking at this sort of data, saying, well, if you're over 60, getting the AstraZeneca is the best thing to do. Whereas if you're under 60, the risk of the blood clot is probably too high for the risk of the disease. So if you're over 60, having that AstraZeneca is really, really important. If you've had the first dose of AstraZeneca, really important you go back and get the second dose, because the risk of blood clots with the second dose is greatly, greatly diminished. It's really a first dose problem. If you've had one dose of AstraZeneca and you haven't got a blood clot, you're going to be fine with the second dose. The risk is really small, not zero, but nearly. So the thing with the TGA is they collect all the data that we do a lot of investigating of anyone who's been to hospital or anyone who's had a bad outcome after the vaccine. Now, this is the blood clot data. This is publicly available on the TGA site. See, this is from last week, and you can see here on the bottom, 76 people, 36 men and 40 women in Australia have had the blood clot problem. So lots of people have had the vaccine, but only 76 have had the blood clot problem. Now, that's really decreasing now because we're not giving that vaccine to anyone under 60, mostly, unless they really want it. Again, this is from the TGA. You can see here that the blood clot, 22 people have been treated in ICU for the blood clot, 6 previously, and 2 people have had a fatal outcome from the blood clot. Now, if you've had a history of blood clots in the past, you've had a DVT or you've had a pulmonary embolus, anything like that, or you've got a history of blood clots, or you're on any anticoagulants, you don't have to worry, because the issue with the blood clot is really a problem caused by the immune reaction to the vaccine, whereas normal blood clots are not immune mediated. So if you've had a DVT before and you're over 60, you can safely have the AstraZeneca vaccine. The risk of blood clots for you is no higher than for the next person. So having a history of blood clots, or a family history of blood clots, or a history of ischemic heart disease or strokes is not a contraindication to getting the AstraZeneca vaccine. So if you're over 60, you've got a history of clots, still talk to your GP, get personal advice, but it's not a contraindication. Now, in terms of understanding vaccine hesitancy, there's lots of ways we think about risk. I'll take my hat off now. Lots of ways we think about risks, and it's the way our mind works. And this is what the psychologists called heuristics. And so it's a mental shortcut how you balance up risks. Now, you may have heard something hearsay. People may have spoken to you, and then you process that and you say, oh no, there's a risk of blood clots with the vaccine, or I'm worried about this with the vaccine, or my pastor said that about the vaccine. But you need to understand how we make these decisions. So Some people anticipate the negative emotions of a decision and avoid taking the course. You think, I don't want to deal with a vaccine. I'm going to put it in the future. I don't want to deal with that now. Some people say, well, if I don't do anything and something happens, that's better than me doing something and then something going wrong. So I'm not going to go and have that vaccine. So that's what we call an omission bias. And then if we avoid taking risks when the outcome's uncertain, if we think taking the vaccine's uncertain, and then we avoid having the vaccine. So this is the way our mind works. So when we're looking at having the vaccine, we've got to understand how we make decisions. Now, you don't need to know all the information, but Hayley's given you some really good background. Vaccines are incredibly safe. Nearly everyone on the planet gets offered a vaccine. We're trying to reach even the poorest people in third world countries with a vaccine to protect them so they can grow up strong. So these are really tested products. We know there's been hundreds of millions of vaccines given in the United States, in the United Kingdom, all over Europe, and we're trying to get them out to other countries in the world. These are not untested products, and everything is open. Everything's on the TGA website. There's nothing hidden. So you don't have to worry if you've heard some bad stuff about vaccines. You can put that to one side and make a decision that, no, I can see vaccines are the right thing to do. But there is a lot of misinformation. So this on the left is a terrible letter drop that come from Clive Palmer's group where he's trying to scare people. On the right-hand side is the real data from the TGA. So if you look at that middle box on the right-hand side, you can see there that 36,000 reports of an adverse event have come into the TGA, but that's a good thing because we want to know what's going on. Now, most of those are just a sore arm, or people have had a headache, or people have had a day off work, and they report to the TGA they've had a problem after the vaccine, but they're mainly minor. Yep. Now, if they're serious, like the blood clotting problem, then we find those issues and then we can change the rules. Oh, let's not give this vaccine to anyone under 60 because we're worried about the blood clots. So out of 8 million doses given in Australia, 36,000 reports, and most of those are trivial. So what the Clive Palmer group's done is they've looked at this data and then made a big fuss about it and taken the numbers and tried to misrepresent them. So it is good news because everything's open. Now, you maybe you're not born in Australia, or maybe you come from a country where the government hide information and you're worried about how honest the government is. Well, in Australia, the TGA is the government's representative in terms of making sure all medicines are safe. When you go to the pharmacy, all those medicines on the shelf are approved by the TGA, and the TGA can do that because they're open and transparent. So the government in Australia is not trying to hide anything. There's no hidden things here. This is just on a public website. You can go and have a look at it. You can talk to your doctor or your family about it. There's nothing hidden. So when you see these things that are misrepresenting the information, or you hear some bad stuff about vaccines, don't let that sink in and then you make a decision about not having the vaccine. If you're thinking about not having the vaccine, really try to explore it with someone. Now, if you're talking to people who are worried about having the vaccine, then don't judge them. So this is a wonderful graphic from Julie Lee's group. It's available on the net. So it's really important that you listen and be curious and try to find out why someone's making that decision, because you're not going to badger them in to having the vaccine. And then you may be able to find ways you can talk to people about having the vaccine. You can say, well, you're obviously concerned about your health. What are your worries about having the vaccine? So here's a good example. This lady on the top says, oh, the vaccines have arrived so fast. How do I know they're safe? And this guy's saying, well, COVID vaccines went through the same safety checks as any other vaccine, any other medicine, but rather than the science being sped up, it was the administrative side and the funding side that was sped up. For example, if you're a big company and you're making a vaccine, you've got to go through all those stages, stage 1, stage 2, stage 3. So you're not going to build a big factory to build vaccines and make vaccines if the trials are still going, because you want to make sure that product's been approved before you start to build the factory. But with COVID vaccines, everything was happening at the same time. Everything was happening in parallel. So before the vaccines got approved, the factories to make the vaccines were already being built. So things were happening in parallel rather than one after the other. So the reason the vaccines are on the market quickly is because of the need, because we need to get the world back to normal, and because things were done at the same time rather than waiting. So it was the administrative side that was sped up, not the science. All the safety steps were done absolutely judiciously. Now, people are asking, well, if I get the vaccine, can I still pass on the virus to someone else. And this is two recent studies that are saying that the vaccine does a lot in terms of stopping you transmitting the virus. The left-hand one is a study from England involving 365,000 households, where they looked at, well, if someone's got the vaccine and then they get the virus infection, are they passing it on to their household members? And they found that over 50%, so it stops half the transmission if you're vaccinated, and that's household members. That's people you're living really, really closely. So for casual contacts, it's going to do even better. So that's a huge result. The one on the right is an article from Nature Medicine from an Israeli study where they people who were vaccinated, and then they did swabs of the nose, and they found that the amount of virus up the nose of a vaccinated person was greatly decreased compared to an unvaccinated person. So vaccines are really good at protecting you, over 90% chance of keeping you out of hospital, and they're good at protecting the people around you. So if you think of the nursing home outbreaks that we saw last year in Australia, in Sydney and Ryde, and there were dozens of residents who got sick with COVID, who went to hospital, and you compare that to the 2 weeks ago, there was an outbreak at a Baulkham Hills nursing home. Only 5 residents went to hospital, and they were all right. So nearly all the residents were vaccinated, and only 5 had to go to hospital, and they're all okay. No one died because the residents were vaccinated. Now, only 1/3 of the staff had been vaccinated, which means 2/3 of the staff had to be excluded from work for 2 weeks because of they weren't vaccinated, and they needed to protect the residents somehow, so they had to pull those staff out. So if you're a staff member in an aged care facility, your ability to protect the residents and to protect yourself and to protect your colleagues is really high if you go get that vaccine. Now, it's a hassle to go get that vaccine. Liz, at the beginning of this meeting, made it clear that they really want aged care workers to get it. So the Belmont facilities there's the hubs in Tamworth, Taree, Armidale. So there's places where you can go get it, or you can get it from your GP. If you're over 60, the AstraZeneca vaccine. If you're under 60, the Pfizer vaccine. So you really need to look at the science, look at how important your role is, and see the difference between what happened in nursing homes last year compared to this year. It's chalk and cheese. So you don't want to be the person who's unvaccinated bringing that virus into that nursing home. So you imagine the poor limo driver in the eastern suburbs a month or so ago, and he wasn't vaccinated, and he picked up some airport staff, some airline staff, and then he got infected, and now we've got this huge lockdown in Sydney. Now, you don't want to be that person. You want to be protected. You want to make sure that you're protected yourself, and you're not going to get sick. You're not going to end up in ICU. You're protecting your family. So when you go to work, you're not going to bring any COVID home to your family, and you're going to protect the residents and your colleagues. You've got a huge role. It's really, really important that you take the trouble to go and find that vaccine and go get it. At the beginning of this Sydney outbreak, after the problems in Bondi and Bondi Junction Shopping Centre, there was a party in Western Sydney in Hoxton Park, and there were about 40 people at the party. 34 were unvaccinated. They all got COVID. There were 6 who were vaccinated because they were healthcare workers. They were at the front of the queue, and all of them are all right. So these vaccines work really, really well. You can protect yourself, protect your family. If you've got worries or concerns about having the vaccine, talk to your manager, talk to your colleagues, talk to your GP. Don't let little things sitting in your head here worry you and you make bad decisions. So if you've got to look at the evidence is that nearly everyone in the world gets vaccines. They're the most tested product. Hundreds of millions of people have had these vaccines that is on offer for you now. There's nothing hidden in them. There's no hidden agenda. Everything's up front. The safety data's up front. You can look at it on the internet. I've showed you here today. Hayley's given you a really lovely background. These things are much, much safer than getting the disease. So take the trouble and go get yourself vaccinated. If you've got worries, talk to someone and really test those worries and don't let them make you have a bad decision. The government's already made one bad decision in not vaccinating you when they vaccinated the residents. Don't you add to that dilemma. Take the trouble and go get vaccinated. Thanks.
Thanks, Patty. Very, very much appreciated. Thank you both, yourself and Hayley. I think that was a fantastic session. I know the comments that are coming through. The question bar have been lots of praise, and well and truly the questions that you've included responses to in both your presentations, I believe, have been answered. There was an earlier one just around long-term side effects not being necessarily known at this point. Patty, you covered that. And then Hayley, there was another question just to double check around the advice, official advice changing for pregnant women, specifically those working in aged care, but I know you did go into detail around the advice there in your presentation. So we might have gone over time a little bit, but it was well worth it. So thank you both. Before everybody, I'll let you both go if you need to go back to your busy lives. I've just got to update everyone else online briefly just on our health pathways, both our health pathways programs that can give you all of the information that all three of our presenters today have touched on. So bear with me a moment and I'm just going to share my screen. Okay, now when everybody sees that, could you let me know and I will kick the presentation off. I think you should be able to see that right now. So I'm just going to scroll through and let you know that the first slide that we've got there is actually the Hunter New England Health Pathways site. So it's got the login details, username, password. It's the same for anybody who accesses it in the Hunter New England region. And there's also a patient info website, which doesn't require a username or a password, but it is what contains all the patient or community resources. Now, this slide here actually touches on how to find COVID-19 vaccination information and residential aged care facility COVID health pathway pages. So those that are highlighted, you might be able to see in yellow, are the specific COVID vaccination links and pages. And if I go to the next slide, what I can show you is what it looks like if you log into, or you don't have to log into, but if you visit the patient info site. So this is where you can get all some really excellent patient and community resources relating to all things COVID and COVID vaccine. Now we do have a localized Hunter New England Health Pathways site, and we also have a Central Coast localized Health Pathways site. And up on your screen now should be the username and the password for the Central Coast site, and as well as the website link. And then the next slide, and obviously we will send this information out to you because I'm kind of going through it quite quickly at this point. But what it shows you is where the pathways for the Central Coast around COVID vaccination and residential aged care facility COVID outbreak management are sitting. And this one, it might look a little bit busy, but what it's actually highlighting is with the green arrows that are popping up there is under the COVID-19 referrals where the locations are for vaccination. So where people can access vaccination sites and hospital hubs, etc. And the very last slide there is just about the patient info. So it's another view similar to the one that I showed you before when I was showing the Hunter New England Health Pathways site. And this again can be accessed by anybody. It doesn't need a password or username like the other two sites, and is a great place to direct people to if you're looking for something that is community or patient or at that level for them to be able to understand. So we are back now. I think I can stop sharing my screen. There we go. Over to you, Charles.
Wonderful. There has just been one last question that I thought it's probably a cohort of people on this webinar that might be interested in this. So I might just open it up to whoever might know the answer. So it's from Karen. She said, are home care aged workers who attend people's homes getting vaccines as well? Who's best to answer that one?
Yeah.
Yep.
I'm actually happy to send out some information with, oh, sorry, Hayley, you go first.
So what we know is residential aged care need to have it by September, at least their first dose. There's been no mandates in the HAC space. However, it is highly encouraged and you can present for vaccination because you work with vulnerable people.
Brilliantly
Wonderful.
said. Thank you.
And I'm getting pretty nice.
Thanks very much, Hayley. All right, everyone. Thanks so much for attending today and appreciate you staying on. As mentioned, this is being recorded and will be available from tomorrow on our website. So please share the recording link with all your staff who couldn't make it live. And obviously, a big thank you to Patrick, Hayley, Kim and Liz for generously giving your time today. Everyone's very busy at the moment. So yeah, it's really valuable information, really timely information. Just a reminder that the evaluation survey will pop up when you exit the webinar. So if you just take a moment to fill that out and give us some feedback, we'd really appreciate it. So thanks everyone again for joining and we hope you have a great Arvo. Thanks.
Bye.
Thank you. Bye.